Good evening, everyone. Thank you all for joining us today. Before we get started, Councilmember Hagman is going to lead us in prayer. I ask everyone please stand for the pledge.
Dear Heavenly Father, I just thank you for this time we are allowed to gather together to review city business and hear from the public and make sure we do our best to make the right decisions to help the citizens of this town. And I ask, Lord, you just bless this council tonight. Amen.
Again, thank you all for coming. We're going to go ahead and get started. Our first item on the agenda tonight is to consider approval of October 1, 2024 regular session minutes. Council, if we've had a chance to review the minutes, the floor is open for a motion.
I move to approve.
I second.
Motion made by Councilmember Sproul, second by Councilmember Redford. Madam Secretary, record a vote, please.
Aye.
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 All right. That item is unanimous. We'll go ahead and close it on the agenda. At this time, we have public comments. Anyone that would like to speak at this time, please come up, state your name, address, and address the council. Now, you will have to hold that mic throughout its entirety while you're speaking.
First of all, I'd like to thank everybody for being here. And Mayor, I appreciate you and your staff. And I know I've been coming here for off and on, but just watching and listening, but I've had a multitude of problems since I've been here. Came here with great intentions. My mom and dad are from here, Naples. I came here to raise service dogs. My uncle gave me property in Naples, but I had a rough go at it because my brother messed up the property. And make a long story short, my house burned down, and I had to go into the burn center. But prior to that, I had pneumonia after living out in Winfield, dealing with bad landlords, and they had to fly me on a helicopter to Tyler. And just came back from a surgery yesterday in Tyler, and again, it was a bad experience. The doctor had told the people that were sticking my arm that they were doing it wrong and not to do it. Like, he sent a letter to me, but this time he was pretty upset. We talked in detail, and this was yesterday, and I finally got the VA to help me with transportation. And I've been trying to work with them for the longest and had no help. But most recently, I've found people that have been interested in my situation and trying to bring some unity here in this community and elsewhere. And it has, like I said, it hasn't been a cakewalk, and I'm very heartbroken. I'm tired of seeing people suffering. I've seen a lot of people from my church and at the place getting fired, trying to go to school to better themselves and getting terminated, and they're the best nurses. And it's bad on me. I've seen people there dying because they're not getting any support. Being discouraged. My own cousin died at this kidney place, and her uncle was the late great ZZ Hill. And I spent a night at their house in Compton, going to San Diego. That's heartbreaking. And then my other cousin, he's about the only athlete that's come back to this area and trying to do something. His daddy was the first person to hit 4 home runs in the World Series, Don Buford Sr. And it's just pathetic. We can't get along. and I'm catching hell. My niece has been my cousin's been living around the corner from me because of the people that I work with in Naples, the men's breakfast, the coaches' breakfast. They helped me when I had all these problems, and I was able to help her with a place to stay when my house burned down. And people have been threatening us because they don't give a damn, and I do. That's all I got to say.
Okay.
I'm almost too much by myself, but I've seen my people suffer too daggone much, and I've been doing this all my life, you know? From the school I went to, and ever since I was a teenager, went through this I'm the same age as Tookie, never gang bang, and got all these grown-ass people out here who want to sea walk.
All right, thank you, sir. Uh-huh, mm-hmm. All right, do we have anyone else at this time? All right, we'll go ahead and close public comment. We'll go ahead and move on to item 3. Item 3 is a presentation of donation to Guadalupe Herrera from Trailer and Associates.
Mayor, I would just like to say, we were at TML last week, and we went to Trailer and Associates reception that they had, and Guadalupe was the winner. And so we have Wesley Trailer from Trailer and Associates here to present that to her.
All right, thank you.
Mayor and Council, I'll be quick. My name is Wesley Trailer with Trailer Associates, and as Candace was saying, we're really excited to be here tonight. We did have a reception at TML last week in Houston, Texas. There we were celebrating our itty-bitty little 50th anniversary of 50 years of continuous business in East Texas, serving communities like y'all. It's nothing to y'all's 176 years in existence, but we're trying to do everything we can to get to 176 years ourselves one day. But we did have a drawing when we were at our TML party in Houston last week. We had 2 different raffles last week. One of them was for $500 donation to a police department, and then the other one was $500 to a fire department donation. So Lucky Guadalupe put her card in the stack, and we pulled her name, and she drew the one for $500 to the fire department. So we just wanted to come here and give y'all that donation. And again, thank y'all so much for your continued support of us.
All right, thank you. I think that deserves a round of applause. All right, yes, we did have a wonderful time there, and we certainly had a good time at the dinner. We thank you. Mm-hmm. All right, we'll go ahead and close item 3. Now we'll move on to item 4, which is a presentation on medical liaison services available from Shalita Bratton. Ms. Bratton? I will say it's a pleasure to have you here today. We're looking forward to hearing about the liaison project and all you guys have to offer us. Do you want to pass those out? Okay. Okay, as you're speaking, I know it's a little difficult, but you have to hold that button down the entire time that you're speaking.
This one.
Yes, ma'am.
Yes. Can everybody hear me really well? Good. Mayor, Council, it's an honor to be here, actually, to talk to you all. It's the first time I've actually spoke to a council, which is really wonderful. I've actually been talking to Mayor Craig for several years, and several of the previous city officials. I'm driving back and forth from Dallas, working there and working here in your community. Your previous chief nursing officer that was there at TRMC, I was the provider that they would call when they had patients who were frequent ER flyers, because I do mobile medicine as well as clinic medicine. So if they had someone in your community who needed to be seen in their homes because they had transportation issues, needed orders and couldn't get medications, I was the provider that they would call from Dallas and I would drive down. So I did that several years before opening a practice here in Mount Pleasant. So I am an independent primary care provider here in Mount Pleasant. I am located at 2001 West Ferguson Road, Suite 3000. That's right next door to the WIC office. And I see patients there. I've been there now for about 2 years. I still do mobile medicine and I still also work in the Dallas area. So I'll tell you just a little bit about me and then what we've been discussing. So I am currently on the board of advisors for the National Breast Cancer Foundation. So that's a wonderful thing that I get to do regularly, consulted with home health agencies, hospice. I was previously a board member for the North Texas Alzheimer's Association. I've been a case manager, director of nursing, so this is what I absolutely love to do, which is community health. When I got here, I found out that Mount Pleasant did not have a community health liaison. And in order for community health to actually be community health, it has to involve the community as well as the city. So not just the hospital system, but an independent person or persons who is not necessarily connected to or work for either of those hospital systems, to make sure that the community has options. So I get a lot of people coming to my office, like for instance, Christus has been to my office and they now partner with me in my office. So their electrophysiology clinic happens in my office now on Thursdays, which is wonderful. And then they now have a clinic at the end of the block right in my vicinity. So I'm able to serve both TRMC and Christus patients, as well as independent patients, entrepreneurs who don't have insurance. We serve indigent patients, a lot of women and families from Hope House. So we get to do a lot of community service, which is really wonderful. So a community needs health assessment is done by TRMC every 3 years here in the community, and they've identified some major areas: mental health, which is a big area here in this particular city, chronic illness, increased utilization of their ER department, increased readmission rates resulting in Medicare retrieving money back from your hospitals, healthy living, and aging, which is of course definitely an issue for all of us. Aging is definitely particularly special to my heart. I moved my parents here once I started doing my work here, and both of my parents are aging and disabled citizens. So I moved my dad into a nursing home facility here in Mount Pleasant so that we can really get the full Mount Pleasant experience. We had an issue once where my dad was brought into the hospital and was scheduled for a hip surgery, but there was no communication for them to know that he was a transplant patient. A community health liaison person, someone that bridges the gap between the nursing homes, the hospital systems, the home health agencies that are not necessarily being paid by either of those, would have been able to bridge that gap. So I met with the hospital, met with the ER directors, met with the CEO of the hospital, because I didn't want it to happen to any other person. Thank God my dad had me, but there are a lot of people who don't have people like me in their families or with them that know the healthcare system. So that could have been a disaster for myself, for the director, for the surgeon, to have to do surgery on a patient and then realize after that that the patient was a transplant of both heart and kidney. So we were able to prevent that. So things like that actually happen. That community health liaison would be the person to make sure that communication happens, go into nursing homes and teach things. Now, a lot of the state services require that you have an independent person to come in and do education. And when they come in and do their state surveys, you have to show that you had an independent person come in and do education. So I want to bridge the gap between what's happening in your community and the city actually having involvement in that, which is a non-biased party, which is wonderful. Okay, so there's one more thing I wanted to tell you. Some of the things that I've already been doing, which is bridging the gap between some hospital systems. You have a large population of people with Christus Health insurance, but then there was no Christus Health in the city. So we had a lot of patients coming to my office, and we didn't accept Christus Health insurance yet, but we were willing to take those patients anyway. So it's been a wonderful thing now that patients have other options as well. It still brings funds into the city to have multiple providers. I've worked for multiple hospitals as resource for Methodist Hospital System in Dallas, THR, I don't know if you've ever heard of Texas Health System. So I was a resource case manager going to all those hospitals and bridging the gap. I've met with the CEO of TRMC to discuss transitional care, which decreases the number of people that come in and out of your ER, and making sure that they're seen at home. I am the only house calls provider in the city, which is challenging, but I'm up for the challenge. And we need more providers that are willing to go and see our elders in the home, or even our disabled in the home, or even people who can't get back and forth to the ER. I had one patient that your CNO sent me who was over 500 pounds, and she could not get into an ambulance, and she could not find a provider who would see her. So I would drive back and forth from Dallas to make sure that she had what she needs. So a community health liaison, those are the things that you actually get to do on behalf of a city versus on behalf of a hospital. Because sometimes hospitals have things that they can't do or go out and do. So we're able to do those types of things, which is wonderful. I'm working right now with a company called Purple Hearts. It is a home health agency specifically for veterans. So part of what I do as a community health liaison is find resources in your area. And because everything is so spread out and communication is a bit challenging, it's really necessary that people know what their resources are. So I get a lot of veterans in my office that have no idea that there is a company that does home health, that sends nurses and aides to your home, that 80% of their patients are veterans. I just heard a veteran speaking just a second ago. It is very hard to find services. And some of the people don't have transportation, and you don't have public transportation. So you have to have some type of bridge that will make sure that they get those services and know that those services exist, that are not necessarily connected to a particular hospital system. The challenge with hospital systems, which I love, and I've worked with them, but they will refer to that hospital system and that hospital system only, unfortunately, sometimes. So the thing that I get to do for community is study all the hospital systems. You have another one 10 minutes from you. There is no psychiatrist in the city of Mount Pleasant, but there is a behavioral health clinic about 10 minutes from this city. So I get a lot of those psychiatric patients. I found a psychiatric counselor. His name is Joseph here in the city, who's been seeing a lot of my veterans because they need counseling. So I get to do that as a community health liaison. Let's see. I think that's all I wanted to say. I did give you some information about what a community liaison is, or community liaison officer. It interacts with the local community on behalf of an organization, such as a police department, a school, or city. Their duties include providing information, translation, or training to the people in the community, like your new recreation center, which is really awesome. But a community health liaison would offer free education classes in that recreation center once a month. Classes including diabetes, high blood pressure, all of those chronic illnesses that our citizens are fighting. To have those classes would be ideal. I hold them now in my clinic. I have 6 chairs, but people do come. I also go to several churches, one Shepherd Street Church of Christ that I've been to, the church that my husband pastors here in this city, Unity Church, which he pastors here. That's how we found out that the healthcare need was here as we were doing ministry work. So I gave you some information about my resume, what I do, as well as I gave you information about a community public health liaison. This is one of the only cities that I've found in this area that does not have a community public health liaison. It is very much a job and a position, but it is something that's vital for the health of the city. That's my spiel. Does anybody have any questions?
All right, thank you. I want to say, like you said in the beginning, we have spoke about this for years. And I spoke with Mr. Nyhoff about it. And I've looked at other cities that have them, and we, or as I know, we're probably, as you said, the only one within our area that doesn't have one. The needs are certainly there. When it comes to veterans, just like the guy that just left here, I know transportation is a big issue with veterans getting back and forth. And not only veterans, but some of our own citizens here. I had spoke with Greg about a good friend that passed about a year ago that didn't have transportation back and forth. He had to go to Longview or Tyler for his dialysis, you know. So, and sadly, he passed away. Couldn't get to get his medicine and all that kind of stuff. So, the need is definitely there. The education that the citizens need to know that you can provide, I don't see anything but a benefit to it. I'll leave the floor open to any questions this time.
I do. Well, first I want to say you've got a precious heart. It sounds like you really have a heart to help people. Even though you are married to a pastor, but I think that it's something God's given you. But what is it? So I was listening to you. What is it that we would do? I mean, it sounds like you've already got this going on. So what is it that you're wanting the city to actually do?
It is actually a city position. I'm just doing it because I know it needs to be done. And somehow people find out that I'm here, like veterans programs and things like that. So they just show up in my office and sit for a while, which I don't mind. But it is an actual position.
And I've actually had citizens, several veterans that contacted me asking me why we don't have it.
So, since you've been talking to our city manager about this, was this something that he was preparing for when he worked the budget as far as positions and stuff?
From my knowledge, we spoke this prior to the budget, and he was saying that once we get the budget, we'll know where we're at. So that's something that we'd have to speak with him on now that we've got the budget in place.
But please know I'll keep working either way. I am now credentialed with several of the veterans insurance, like Champ VA, once I found out there was a need here. So I am part of their choice program. So we're getting the word out that I do see veterans in my office, because the closest veteran or VA clinic you have is in Longview. So I have a lot of patients who go there until they find out that they can be seen in my office as well.
Yeah, and there are several veterans here in Mount Pleasant that do go to they'll go to Longview, Shreveport, and Dallas. Myself as a veteran, I go to Dallas. And making appointments is pretty tough as a veteran. You have to make them several months out sometimes, and it's very time consuming, especially if you can't make that appointment, then you're waiting months again to get seen. So it's kind of tough. Like I said, a lot of phone calls from veterans about this, and I just want to ask that she come in today to give us a presentation to let us know what's available for our community.
I'm going to second what Kelly said and really appreciate you coming up. And I was reading through this community public health liaison on top of your resume, which is, you put a lot of schooling in, and a lot of people have become nurses, go all the way as far as you did. So I commend you for that. I did make a note to talk with the mayor and city manager. So once our budget's done, so see how this could work. So definitely, I know the need is great, and definitely appreciate people like you.
Thank you so much. Stop by the office anytime and tour. I'm usually here all day on Tuesdays, so people do stop in, come tour, see what we're doing, but it's open to anyone.
So question. So you're doing a lot of this yourself.
Yes, ma'am, I am.
This button is hard. I'm so sorry. So since you're doing this all by yourself, there's a lot of ministries or 501c3s here in Mount Pleasant. Have you reached out to see if any of them can help you with the legwork?
Yes, I partner with several right now, namely like Hope Ministry. When I first came, I've been serving here now maybe 7 years, before I actually put a brick and mortar clinic here. And I've been partnering with Hope Ministries and helping them with a lot of their residents because they take care of women as well as seniors. So I've done a lot of work with them in the past, a lot of education, and even now. And they're across the street, so it makes it a lot easier. But yes, I do.
You have any further questions? All righty, thank you, Ms.
Thank you for having me. Come see me.
All right, at this time, we'll go ahead and close item 4 on the agenda, and we'll move on to item 5. Item 5 is to consider pay request number 17 from Heritage Construction LLC for work performed at the Southside Wastewater Treatment Plant.
Mayor and council, how y'all doing tonight? Yeah, this is for pay request number 17 on the work that's being done out there at the wastewater plant by Heritage in the amount of $1,158,805.77. This payment is going to be, they put in some piping and some diffusers in the west aeration basin. They've also put in the sludge rakes and some other mechanical stuff. We've got some pictures actually. I hope they come. No? Okay, they didn't come through. I'm sorry. But the pictures are in y'all's packet. I apologize for that. But there's sludge rakes and they put in the east and west clarifier. So it's looking really good. Y'all will be able to see the pictures and see what's going on. But like I said, this is in the amount of $1,185,805.77. The adjusted contract is $41,012,657.85. So completed date cost is $25,531,897.99. Percentage of time complete is 66%, and percent money is about 49%. So we ask for approval to pay this request.
All right, thank you. Council, do we have any questions?
How are they on the schedule?
I have Mr. Reynolds here. I believe he can answer that a little better than I can.
Mr. Reynolds, please approach.
Mayor, council, thank you. Schedule, we're on track for third or fourth quarter completion of 25. We've had some rain days and then some 2 change orders or field orders that added days to the schedule. So we are looking at less than a year out from completion, final.
Any further questions? All right, if we have no further questions, I'll open the floor for a motion on the item.
I make a motion to consider to pay request 17 to Heritage Construction for the Southside Waste Water Treatment Plant.
I second the motion.
All right, we have a motion made by Councilmember, excuse me. Motion by Councilmember Hagman, second by Councilmember Hinton. Madam Secretary, record a vote, please.
Aye.
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 Vote is unanimous. We'll go ahead and close that item on the agenda. All right, items 6, 7, and 8 at the request of Crystals will be removed from the agenda for today and be added back to our agenda in the near future. So we're going to go ahead and move on to item 9, which is a response from Datamax to notice from the city of breach, default, and opportunity to cure, and possible discussion and action on the current contract between Datamax and the city of Mount Pleasant.
Hello, council. Hello, Mr. Mayor and Councilperson Spruill. It's nice to see you again. Hello to the new members of the council. So first I want to start off by saying thank you for allowing me to meet with you tonight. We are very much appreciative of the business relationship that we've had with the city. We've had the relationship for some time now, managing the technology infrastructure that's in place out here and working to make sure that everyone is taken care of. You have a very dynamic city with a lot of moving parts, and it's a fairly complicated technology infrastructure that you have out here. But I do appreciate the time that we've had together, and I thank you for that. So we've worked with city governments for a long time. It's an important part of our business. We have many city and county government clients throughout the state of Texas and into Arkansas. We are very familiar with working with public safety organizations. We're familiar with working with City Hall. We're familiar with the differences between those. We are a local company. We have offices in Sulphur Springs, Texarkana, Tyler, Longview, Lufkin. I mention these things mainly just by way of getting to know each other. It's the first time I've met some of you, and I want to make sure that we know each other so that we can have a relationship. We are one of the few private sector organizations to have earned the Texas Cyber Star designation from the Texas Department of Information Resources. We are Texas CJIS certified, which means that we're qualified to work with the police department, with city governments, and that requires extensive background checks and fingerprinting and documentation that you file with the FBI and with the state. I do want to let you know that I'm in receipt of your letter, but I am not quite sure what to do with it other than have a conversation about it. In all the time that I've worked with city agencies, county agencies, I've never had the obligation put on me for maintaining documentation of work that we've done. That's always been the responsibility of the folks that we're working with. Either items are approved officially by council, or they're approved by the folks within the city administration, and we go on about our business. We don't have a checkbook, we don't have a credit card, we can't spend any of the city or county's money unless somebody agrees with the work we're doing or the services we're providing, and then we provide those services. So I'm not sure what to do with the letter other than continue the conversation and find out where the disconnect is. I know in some of the line items that are in the letter, we're talking about data backup and we're talking about licensing and us being in breach of those things. But frankly speaking, if we weren't in compliance with Microsoft licensing, the city would not function. You would be in violation of Microsoft licensing provisions and subject to audit and fine by Microsoft through the Business Software Alliance. If we didn't maintain data backups, we wouldn't be able to do public records requests, or we wouldn't be able to pull data that people have deleted. So if there are gaps in record keeping, I mean, it's new to me that the responsibility is mine to produce authorization of that. We've been working with the city for some time now and providing services in a best practice based workmanship manner. So to receive a letter that says you are in a breach of agreement, that I don't know where to go with that. In fact, I haven't even turned that letter over to our attorney because that's not the way we do business. We're a relationship-based company. Once we have an agreement, it's based on a handshake and we fulfill the agreement. So I am interested in continuing the conversation. I'm interested in fulfilling the duly authorized agreements that we have in place and continuing them through the end. I'm interested in continuing the conversation to figure out where things have gone wrong. But you know, this was the first opportunity that I had to meet and address the letter and the concerns, and I'm willing to put more time into it. So with that, I'm not sure what else to say about the letter.
All right, council, the floor is open for questioning.
Hey, this is Jonathan Higman. I think where this started initially with me is when I was running for election, there was a number of Freedom of Information Act requests based on your current contract, the current value being charged, and the difference between that, which I think you're describing as some of those said services. So what I had requested, and I understand what you're meaning by record keeping, but I simply asked for statements of work that I think your company was supposed to provide, and to date, I think I've only received one, and it was not executed. And so when 3 of these members were newly elected, the city manager that was supposed to be in charge, since we don't have a contract manager, he resigned. So I think, where the relationship is skewed or gray or whatever word you want to use, I think that's kind of where this is starting.
Okay. Well, I'm happy to continue talking and meeting. I think it goes without saying that the city needs to be properly licensed, and you have a best practice-based foundation for doing business. You have to continue that, or I would suspect that you want to continue that. So whatever questions I can answer, I will. We typically have not maintained records of past business dealings. We count on our business partners to maintain those if they are important to them. We produce whatever documents are requested at the time to receive approval and authorization, and then we go about our business.
Understand you don't retain them in some file, but I would think at a minimum. I know we met with your, I guess he's the sales executive now, but he was the sales engineer. I met with him personally, with the city manager, and we discussed, and I think this is roughly over a month now before I think that letter went out. He kind of spoke similar to you, but I guess again, I'm going to fall back on, you should have a statement of work somewhere, and if you only received one, I just don't see how those match up. And just a note, right, I come from an IT background as well. I spent over a decade working with Nokia, delivering lots of transport network deployments. I've deployed AMI deployments, meter data management, maintain mainframes. So, I understand the language you're speaking.
Yeah, I don't know what to say here, because when you say that there's a breach, it implies that there's some kind of malfeasance or problem, and yet the Microsoft licensing is in use every day. You are legitimately licensed so that you conduct business legitimately with Microsoft. You're using it. Everybody's using it within the city. The data backup services are in use every day. So I don't understand, and I don't know if this is even the right forum to have this conversation, but it was the earliest opportunity I had to come out here and meet with you. So if you want to continue talking about it in this manner, I'm happy to, but I'm also happy to come back out and meet and sit down and talk through it. But you're consuming the services that are identified in that letter as being a breach, and that's the confusing part to me.
I have one more statement, and then we can discuss, but if it's such standard practice, why wasn't it part of your original proposal that was signed and it came in later? Because, I've reviewed this a few times with the lawyer, and it was an add-on, and if it's so standard as you're stating, why didn't you initially provide that or some kind of structure around it? There was no pricing included in the contract either.
I always rely on the people that I'm working with to tell me, what do I need to do business? Do we have to have these things council approved? Are you a city manager that has the authority to sign off on this? So we've done business with this city for some time now in good standing. And we've conducted business according to the way that they wanted us to conduct business. So if things need to change, I'm happy to hear that and to do whatever needs to be done. I will work with you to make sure that I can comply with what you need. But the services that are identified in that letter are services that you're using, that you have to use every day. I don't know what else to say about it. I feel like there's a breakdown in communication regarding proper licensing and the requirement to have proper licensing.
All right, did anyone else have anything?
I do.
Go ahead.
So, Justin, on page 3 says, completed documentation is available for client review at any time upon request. A letter was sent to Richard well over 2 months ago, and he gave us a deadline that he was going to have this stuff to us on October 1st, and we are yet to receive anything from him other than a spreadsheet. There was no scope of work sent back. He said he had all those documentation sitting in that room, and that he never provides an invoice without someone signing off on it. He's also stated that he could not verify who was supposed to sign off on it, but I can provide for you documentation that he had signed after, this was after May 13th, when our current city manager had left and we were in the process of hiring a new one, and then there were like 2 or 3 other people signing on invoices. This is information that we had requested from Justin that he said he would provide, and he has yet to do so. Not Justin, Richard, sorry.
Regarding documentation of the technology infrastructure, we maintain that. We have documentation of the city infrastructure. When we have signatures, we don't necessarily hold on to signed documents for any specific amount of time once the work is finished, because our services are delivered. We work things out in real time with people. If there are specific items, then we can talk about it, I guess, but we don't keep signed documents for any specific amount of time once the work is completed. Now, if we're doing a disaster recovery plan, we produce a deliverable. If we're doing, if we're testing employees to find out if they've been trained for social media awareness or for phishing attempts, we maintain that. We have quarterly business reviews where we come and we meet with you and we talk and we say, are there any problems? Is everything okay? And we have documentation that we provide on a quarterly basis. Documentation about the technology infrastructure we have. What you're telling me I'm in breach of is that I don't retain the signed information, the signed documents authorizing the work. And I can't say that I've ever been required to have that available upon demand. That's always been maintained within the archives of the folks we're working with.
Council, Mayor and Council, the contract provides that SOWs are required to be approved by the city, and that if there's going to be deviations or changes or anything like that to them, that it's required to be approved with executed approvals. As the city secretary has already informed you, there's provisions in the contract that says that they are going to keep completed documentation. The city's requested it. They've provided notice in accordance with the contract to Datamax to see if there's, to provide them an opportunity to cure in accordance with the provisions of the contract. In significant part, this is about charges not aligning with what has been approved. And so that's where it stands, and you know, they have 30 days, and so the letter was October 3rd, so I have a couple of more weeks beyond it.
All right, hopefully we can get this resolved. Like she said, like the attorney said, we do have a couple of weeks. Did anyone else have any questions, or do you have anything here?
When Datamax made the original presentation, how long ago was it when we entered into contract with them, please? Do you recall?
It's April 17th, 2023.
23? I noticed that there's some substantial reoccurring charges, looks like for your cloud storage backup. And then the other one that's substantial recurring is the licensing.
I'd have to be refreshed. I'd have to go back and look at the original contract. It's hard to remember everything that's presented to us for 5 years. But I remember a little, and I remember I thought that that was those charges were included in the original monthly estimate to take care of the city. And I'm not saying I'm correct. I'm saying that's to the best of my recollection. And these are some substantial numbers, and if they weren't, how come we weren't given a better estimate at that time as to what these, especially these two $5,000-$6,000 a month reoccurring charges would be, because they are substantial.
Yes. Again, I think we got started working with the city way back early 2020, maybe late 2019. And we have the documents that we sent to the city for authorization. But do we keep the documents that come back as authorized? No, we don't. If they're approved, we go about our business, and we count on the city to maintain those records. So if you would like me to present you with the documents we sent for approval that don't have a signature, I can do that. But as far as having signed documents, I mean, the part that's confusing to me is I don't spend the city's money. I can't go charge a credit card anywhere. I provide the services. Either the city council authorizes it or city staff authorizes it. If there's a problem, we work it out in real time. So I can go back to the original documents that we sent for review, for approval. Whether we have a signature on them or not, I'm not sure, because we don't maintain those kind of things typically.
Lee?
Mayor and council, the contract requires that statements of work be executed from time to time by the parties. I'm just telling you what the contract says.
And I would also like to point out that I think there's a disconnect between you and Richard. You say you don't keep anything. Richard stated to us that for an invoice to be paid, it has to have a signature on it, and they keep it because he has to send it off. So you keep saying you don't keep documentation, but that's not what Richard is saying. So that's the question. We've asked for these signed documents that have been sent back to him in order to submit an invoice, and we haven't received that.
We don't have a formal records retention storage mechanism for signed agreements. Some of our clients have authorized us by email. Some of our clients authorize us by written signature. Some of our clients authorize us by a vote, and we don't ever receive a signed document back. I don't recall receiving signed documents back for everything that we've done with this city, nor with any of the cities we work with. So if simply providing you with the original statement of work that was sent out here, or the email that stated the project or whatever will satisfy the statement of work provision, then we can look that way. What Richard has exhausted and what the team has exhausted is looking for retention of signed documents, which we typically don't have a formal record retention policy for.
Mr. Martin, I'm old school and not huge in technology, so I'm not going to address a lot of this. But the one thing that does concern me is I'm a business person, and every signed contract I have ever done with somebody or I have received, I've kept. I've made sure I can get my hands on it, especially within the time limit of when the IRS could come and do an audit. So I'm listening as far as you don't have a retention of a signed contract between the city of Mount Pleasant and your business. I mean, I'm like, really? Because how many cities are you providing service to?
Yeah, we work with quite a few cities and public agencies, and it's just not been a problem. I started this division. I've been in the technology business for 27 years. It hasn't been a problem for me. So I respect what you're saying and I understand, but I have a business history of working relationship selling, conducting business based on a handshake and doing what I need to do for my clients to get authorization and then doing the work, and it hasn't been a problem. So we can provide the original document, but if there is a retention, if having a signed document is important to the city or the county or our private sector clients, we count on them to retain that. Because otherwise they would object to us in real time and say, hey, we don't want that computer. We don't want that work done. We're not going to pay for that. But in this case, it's been paid for. We have a history of all these things being paid for.
Okay. I guess my thing is the what was agreed upon, and I understand what you're saying. But what was agreed upon, I'm just kind of trying to figure out the charges that amounted to $146,000. That's over what we originally asked. Those charges, I understand you said we got the services, we're using the services, and I also get from the council that, okay, why weren't they part of the original deal? So it's obviously we got to go back to the drawing board with this. I'm not sure where the council sits with it right now. This is just a response on the agenda tonight, but it's something that we definitely have to revisit. It's something that the city has to have. So at this point, if the council doesn't have anything else, we'll go ahead and close it. Did you have something?
I was just gonna say that maybe we just need to, if not this session, the next one, put it in executive session and discuss.
Okay, we can go that way. Lee.
Mayor and council, you have the ability to recess into executive session or to move an item into executive session if you want to. That language is on your agenda, and you can do that on this if you would like to do so. We do have an executive session.
Yes, ma'am. I'm aware. If that's what you guys would like to do, if you guys would like to go executive session at this time to address this item, we can do that today.
We can do it at the executive session. I mean, just based on where we're at on the schedule, right? I mean, there's a couple weeks to cure, and so it's not like we have to, stop right now, come back and go out and make everyone wait.
All right, no problem. Okay. Thank you, sir.
All right, thank you, everyone. I look forward to continuing the conversation.
All right, at this time, we'll go ahead and close that item on the agenda. Move on to item 10, which is a monthly department report.
So there is no city manager update other than he will be back on the 22nd. I will say we had a great time in TML last week. You will notice that the Civic Center has, they will start providing monthly department reports. I spoke to Justin and he was very glad about that. So you will start seeing those in there. And other than that, that's it. We just want to thank you for your time and patience with us.
All right, thank you. So we'll go ahead and close item 10, and at this time, pursuant to Open Meetings Act, the Chapter 551, Texas Government Code, the City Council will recess into executive session to discuss the following. Discussion of possible settlement of claims against KSA Engineers Incorporated concerning 2 raw water transfer pumps and motors used at Bob Sandler Water Treatment Plant. This will be a consultation with attorney. And also discussion of status of recruitment for city manager. And also we have consider board appointments and structure of boards and commissions. At this time, the council will go into executive session. Time is now 7:45. At this time, the council will reconvene into regular session to consider action on items 11 through 13. Item 11 will be tabled, and we'll go ahead and close item 11 and move on to item 12, which is to consider appointment to a Main Street Board. Candace?
So Melissa Conroy has resigned, and the board would like to appoint Lauren Ferguson to take her place.
I make a motion that we accept Lauren Ferguson to the Main Street Board, with her term ending in 2027.
I second.
All right, we have a motion that was made by Councilmember, going blank here, Councilmember Redfern, second by Councilmember Hinton. Madam Secretary, record a vote, please.
Aye.
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 All right, that vote is unanimous. We'll now close item 12. Move on to item 13, which is to consider appointment to the Planning and Zoning Commission.
And Sheila Donnelly resigned from her place on the board, and Wade Clark has applied for her position. And I will say that several P&Z members looked at this, and so did Lynn, and they were all in favor.
Well, I'll make a motion to appoint Wade Clark to the Planning and Zoning Commission.
Second.
All right, you have a motion made by Councilmember Hagman, second by Councilmember Sproul. Madam Secretary, record a vote, please.
Aye.
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 Vote is unanimous. We'll now close that item on the agenda, and that will exclude our meeting for today. I want to thank you all for coming.